Today we are going to talk about Arnold Gesell and his maturational development theory and how it relates to child growth and development.
We are going to start out by introducing Arnold Gesell. Arnold Lucius Gesell was born on June 21, 1880 in Alma, Wisconsin. He was an American psychologist and pediatrician who pioneered the use of motion picture cameras to study the physical and mental development of normal infants and children, and whose books influenced child rearing in the United States.
Gesell's theory is called maturational developmental theory. Early in the 20th century, Dr. Gesell observed and documented patterns in the way children develop, showing that all children go through similar and predictable sequences, though each child moves through these sequences at his or her own rate or pace. He believed that a child's growth and development are influenced by both their environment and genes, but he largely investigated the children's psychological development. He called this process maturation, that is, the process by which development is governed by intrinsic factors, principally the genes.
There are 6 stages of Gesell's theory. The first 3 are called smooth, breakup, and sorting out. Smooth occurs at ages 2 and 5. Breakup occurs at ages 2.5 and ages 5.5 to 6. Sorting out occurs at ages 3 and 6.5. Smooth behavior is behavior that seems to be in good equilibrium. Breakup behavior is behavior that seems to make the child troubled or disturbed. Sorting out behavior is when the child is happy within oneself and the environment.
The last 3 stages of Gesell's theory are called inwardizing, expansion, and fitting together. Inwardizing occurs at ages 3.5 and 7. Expansion occurs at ages 4 and 8. Fitting together occurs at ages 4.5 and 9. Inwardizing is when the child experiences emotional instability, fears, whining, and stuttering. Expansion is when the child decides to test limits and expand boundaries. Fitting together is behavior that is in good equilibrium.
Gesell's theory was based on 3 main assumptions. The first one is development has a biological basis. The second one is good and bad years alternate. And the third one is body types are correlated with personality development.
Now we're going to talk about how Gesell's theory is related to child growth and development. According to Gesell, the rate at which children develop primarily depends on the growth of their nervous system, consisting of the complicated web of nerve fibers, spinal cord, and brain. As the nervous system grows, their minds develop and their behaviors change accordingly. Maturational theory states that while the child's social and cultural environments also play a role in their development, these socializing forces are most effective when they are harmonious with the inner maturational timetable. Gesell opposed efforts to teach children things ahead of their developmental schedule, asserting that once their nervous system had matured adequately, a child would begin mastering tasks such as sitting up, walking, and talking from their own inner urges. Gesell determined that growth is best measured not quantitatively but in patterns. A pattern can be anything that has a definite shape or form, such as an eye blink. Gesell looked for patterns in the process by which actions become organized, for example, the steps in the development of hand-eye coordination.
Gesell believed that even newborns could regulate their own development and demonstrated that babies were able to determine their own schedules for eating and sleeping. Gesell also observed self-regulatory mechanisms in personality, overall integration, and equilibrium. Gesell found asymmetric development to be common in children. In motor behaviors, this can be seen in the infant's neck reflex, where babies prefer to lie with their heads turned to one side and extend their arm to the same side which the head is turned, while flexing the other arm behind their head. It is a reflex where the infant directs vision toward the hand or fist in extension. Critics often point out that when summarizing his findings, Gesell gave the impression that all children behave in exactly the same way at each age. However, his position was that the developmental sequences are common to all children, but that they vary in their individual rates of growth. He suggested that these growth rates are possibly related to differences in temperament and personality.
Here is a quote from Arnold Gesell. Every generation rediscovers and reevaluates the meaning of infancy and childhood.
Here are the references that we used. Thank you for watching.